Hi, I'm Karen. I'm one of the lactation consultants at Winter Park. The lactation corner for today, we're going to go over pumping. So these are some of the supplies you need to gather: your Medela Symphony breast kit, some Castile soap wipes to clean, some extra disposable bottles, maybe some syringes, and your clean pump, of course. Okay, so we've got our pump. Make sure it's plugged in. And then please don't just pull certain things out of here. That comes, you open this up, you take it out, there's a bag in here, and it comes with extra filters in case there's rip, because it won't work correctly. There's instructions here, and it shows them how to use the manual pump and all that good stuff, okay? So then we can just put all of our supplies in here. Now I open up the kit and just dump it out. Get rid of all this extra packaging. We can get rid of the lids, put these in here. Now it's very important, this comes with a manual pump, which is very valuable to them. They're over $20 in the store. So where the tubing goes, you snap this in place. Notice I pushed it up. When it comes, it's not usually ready. So we want to mimic baby. So initially, baby sucks really fast to get the milk flowing. So that's the thumb. Once the milk's flowing, then I'm going to go to the slower one. Okay, so just demonstrate it so they understand it. Then you want to be careful with the tubing. Make sure it's all pushed in tightly. It comes from the manufacturer, not secure. Okay, so you want to make sure you do that. We never wash the tubing. It does not interact with the milk. You push that button, lift it. I'm going to snap it in and close it. And then when I'm not having them pump, we just put the tubing here, okay? Because it doesn't need to be washed. So now, these big bottles are reusable. They're hard to wash here at the hospital, so generally we keep them for at home. All right, we use the disposable bottles. And these are the custom feed bottles, and it's nice because they can see how much they're pumping. Okay, that's wonderful. And it comes with caps as well. Okay, so now we come over here and we're gonna attach our tubing. Okay, now they can either pump one breast at a time or two breasts at the same time. Two breasts at the same time, it will go for 15 minutes and it will cycle and it'll go doodaloo and turn off. If they want to do one at a time, which is fine, they're gonna do it for 10 minutes, turn it off, switch it to the next breast, and another 10 minutes. So there's 3 instructions. They tell you on the side, and it even tells you on the screen. 1, 2, and then roll it up to 4 dots. Okay? If 4 dots is too strong, then we can go back down to 3 dots. All right? But it will cycle, go very fast at first, and then it's going to slow down. Okay? Now, sometimes we show moms, especially if it's their first baby, we can show them how to pump upside down. So their nipple needs to be centered, and it should not be rubbing on the inside of the flange. If it is, then we need to go up to a larger size. Now I usually have them hold it like a scissors because I want them to be able to massage with their thumb. I always tell them, you love your baby. Baby at the breast releases a hormone that says, move that milk. We do not love a hard plastic pump. So you don't want them to stare down. I want them to look at their baby, a picture of their baby, think about their baby. And then using the hands. Our hands are much more like a baby. Okay, so if they do this, that will get things going. After 10 minutes, I turn it off. I switch it over. When they turn it off, they need to lean forward, scoop, and slide up because it all gathers there. Ideally if they're sitting on the edge of the bed. So then again, we 1, 2, 4 dots. Okay, and then when they're done, we go like this. Now, tell them it's normal to not get anything out. But if they get a few little drops, you can use a syringe to push it in and suck it up, put the lid on, and we can give that to the baby. Okay, so, but make sure we tell the patients once they're getting milk there, they can turn it upside down so the milk will go into the tubing. Otherwise, it's going to back up in here. They can store their tubing here, their bottles here if they're not using them, and they do not have to wash it if nothing comes out. All right, and all these supplies can be in the bag, and we put it here. Okay, now if they do get something out, we're going to wash. We're going to get new bottles. We're going to use the Castile soap wipe. We're going to open it, get the wipe out, get it wet. We're going to wipe this, rinse it, put it on a towel to air dry. And then we're going to wipe all this. You must take this yellow part off. Make sure there's no milk in here. Rinse it, put it on a towel to air dry for the next time. Okay? Now, if it's a NICU mom, we also give them out a pumping log. Now, it's very important that they pump because baby's not able to. So we need to pump at least every 2 or 3 hours and at least one time at night. Right before bed, pump. Drink a big thing of water when they get up to go to the bathroom, pump, and then drink more water, and then in the morning they can start over. This gives them logs and it tells them goals. So the goal is at least 8 pumpings every 24 hours. So really encourage them to keep pumping. Remember our NICU babies, they need to be started pumping within 6 hours of birth, okay? It's very important for their milk supply. They can also do hand expression, but we got to get them started on the pumping. And also your late preterm infants and any infant that's just not sucking well, they would benefit from getting on the pump to maintain and get their full supply established. All right, thank you.